First and foremost is weight loss. And the more you say this to the owners, the more likely they'll do something about it. Because certainly it took a long time for the animal to put the weight on, and so it'll take a lot longer to convince the owner it needs to come off. But I try and force it with owners, telling them that 1 pound of weight is worth 10 pounds of drugs. So the less the animal has to bear on those joints, on those forces that have arthritis and these issues going on, the more comfortable they're going to be. So really cannot underestimate the weight loss benefit for these guys. So forget no pain, no gain. If you hurt the dog during rehab, or the owner thinks they hurt the dog during rehab, you're not going to have a compliant owner anymore, and you just negated all the benefits. So the goal is to get them to use the leg. And if you overdid it one day, like you went to the gym, you're sore afterward, that lactic acid, if you do that with this patient, you just negated several days worth of work because they're going to hold the leg up. So it's slow and steady. And when they show that they're not liking it, they're stressed out, stop. You either need to change your protocol or stop it completely if the dog is aggressive. All right, so how do you figure out a protocol? Well, first of all, you have to figure out what you're targeting. You're doing the knee, you're doing the patella. If it's a patella, you really want to focus on the quads. If it's just a cruciate, then you're dealing with more generalized range of motion and muscle building, including the hamstrings. So figure out what your goals are. You're just trying to get the dog comfortable for surgery. You're trying to totally prevent surgery, because if that's the case, you're going to be much more aggressive, see them a lot sooner, do more modalities than just 1 or 2 things to make them comfortable. Definitely assess them to know if there's anything else wrong. You don't want to throw a bunch of NSAIDs if they've got liver disease. I mean, things that you guys intuitively already know. And then adjust your protocol. If it's a bulldog and they hate to swim, don't stick them in the tub. If it's a Great Dane that doesn't fit on your treadmill, then use something else. I mean, you definitely adjust it. And for some of my Labradors, especially in German Shepherds, they get bored. So I'll have to switch up an exercise just to keep them excited about it. They get tired of sits or stands, and so that's where we start figure eights. Or maybe they get tired of figure eights, so now let's do circles. So you need to switch it up and keep them excited and motivated, because if they're not motivated, it's not going to work.